you have to think about what you say, because they can weave together different statements into one statement, and it may not be exactly what you intended. So you have to make sure that all your sound bites are things that you're willing to have taken as just a sentence, because that's all that may get in there is 30 seconds. It's not a lot. So it's really fascinating when you see that woven together, that you realize things can be taken in very small snippets, and that if that's all they say, then you better be willing to have had one of your sentences broadcast and none of the others. And that's a little eye-opening once you see that happen to you. You really just want to get to the point right out of the gate. You don't want to give a lot of background explanation. You have to remember you have to always remember you're speaking to the lay public. So if you are going to use any terms, you need to use lay people terms. If you have to use a technical term, then you have to explain what that means, and keep it simplistic. If you're talking about a procedure, in very basic terms, what does it mean? And just keep it as brief as possible. And then let them ask you to elaborate, which most often they do.
The words that we use in describing the issues really make a difference. And again, in APRN land, we used to talk a lot 15, 20 years ago about independent practice. But what we realized over time was that's a word that it's like throwing gasoline on the fire. People hear the word independent and they think, oh, these nurses are going to go off, willy-nilly and never talk to anyone and off doing their own thing. And so, we talked about autonomous practice. Now we've started talking about full practice authority more recently. So that's one example of how we use words and thinking about, how we talk about consultation or collaboration, and how we phrase the issues, and that the words we use are really important.
Dr. Kaplan, thanks for being on the program with us.
Thanks for having me.
So let's start with the case of this nurse assistant in Spain. She had contact with 2 infected priests. From what I understand, she did have protective gear on. Her skin was covered. So what happened here? What went wrong?
Well, what might have gone wrong, and we don't know, but it's very difficult to get the equipment off. That's part of the problem with this equipment. You can put it on, it can be very protective, but if you don't follow very strict protocols in removing it, you might expose yourself to something that's gotten on the gown or gotten on the goggles. I don't know that happened, but that is one big problem with this equipment. It's hard to get it on, it's hard to take it off.
Love the article you wrote recently, because here was your opinion. We caught it from the Washington Post. Revoke the license of any doctor who opposes vaccination. Dr. Kaplan, I got to tell you, just looking at that headline, though, stops you, because you would believe that any physician, well-trained physician, would know all the dangers, all the benefits, all the downfalls of every single thing that they do. So to them to say, I am not going to vaccinate a child or somebody for measles, that flies in the face of everything we've been told that doctors stand for.
I agree. And the reason I think you lose your license is if I come with my child and say, should I vaccinate my child? And you say, no, you don't need to. Or the vaccines are so dangerous that it doesn't make any sense to. Or, as one or two doctors have said, better to get the diseases than to get the vaccine, then I don't have informed consent. I can't make sound decisions based on the real facts. That's where these physicians who are anti-vaccine get themselves in trouble, and that's why I think their licenses should be in jeopardy because they're not informing patients properly.